We have some free seats. And actually, I want to congratulate all of you for navigating through these difficult mazes. Because, of course, healthcare is something that all of us can relate to. There are a lot of global processes, local processes, and all of this has a direct influence on our lives. My name is Kirill Kaem. I am a Senior Vice President for Innovations in the Skolkovo Foundation. I am a doctor. Well, actually, all of my family are doctors. I'm a doctor in the 7th generation. I'm part of the observational council of the medical cluster. So all of these issues related to healthcare when it comes to innovation, when it comes to different payment and reimbursement models, well, all of these subjects are very interesting to me. So we have a very good representative panel today. I wanted to introduce all of the speakers. I see that there is a lot of interest to our topics, but our auditorium is not so large. So we split all of the speakers into two groups. First, we will talk to the representatives of Moscow and Russia. So I would like to introduce Mikhail Yugay, who is the director of the International Medical Cluster in Skolkovo, and Alexei Khripun. Well, since we've gathered here to talk about healthcare networks, I think that a lot of private healthcare networks will actually be quite jealous of the network that Alexei Khripun is managing. So we also have international experts on our panel. I would like to introduce Uwe Bindseil, who is head of the healthcare industry and infrastructure in HealthCapital Berlin-Brandenburg. Sergei Kim, professor of the Seoul National University. He's a representative of the Bundang Hospital. And Gražvydas Morkus, I do apologize if I didn't pronounce your name correctly. Gražvydas is a managing partner of the medical tourism cluster in Lithuania. As you know, this concept of network healthcare is, of course, extremely important. So we would like to talk not only about your projects, but maybe we can cover the approaches to healthcare as part of a network service and how these sort of approaches will help us provide a better service, will help us to improve the overall education in medicine. We will also try to talk at what stages of healthcare networks become more beneficial. Should we have a vertically integrated structure, which should be built as a single network, or should we build healthcare networks at separate levels? So I would like to give the floor to Mikhail, since Moscow Medical Cluster is unique for Russia. The federal government, together with the city government of Moscow, they have worked very hard on this. So this is something that is absolutely unique, that allows to use expertise that is not subject to regulation, and so they can use all of the latest achievements of the international community. Can you hear everything? Can you hear everything? So thank you very much. I would like to thank everybody who actually managed to find time to attend. I do not have much time for my presentation. But, of course, Kirill, you asked an extremely pertinent question. We've established this program some time ago, and of course, that was a very ambitious project, but the question is, what will this project bring to the city of Moscow and to Russia? But if you look at it, then our cluster turned out to be not an absolutely not something that is absolutely new. We actually had a joint research with the Higher School of Economics. We looked at 40 different medical clusters all over the world, and we found a lot of things that were quite similar. So we do expect that our medical cluster will produce similar results, but we are hopeful that our results will be even more pronounced. So what do we call a cluster? Well, a cluster is something that unites a lot of same industry organizations in one geographic locations, and all of these organizations are striving to provide solutions for specific problems. Here we have to distinguish between technology parks and clusters, because when we talk about technology parks, oh no, I do apologize. Both clusters and technology parks are concentrated in the same locations, but clusters have more scholarly scientific representations. Clusters are industry-specific, technology parks not necessarily so. And the main feature is that there are a lot of joint projects, there is a lot of cooperation, so there is a lot of inter-industry work. So this is not true for technology parks. So this is as far as the definitions are concerned. So when we looked at 40 different medical clusters, at 4 different clusters, we saw that there are 3 types of clusters. Number 1 is a comprehensive medical cluster, which have medicine, education, research and developments, and startup companies. Such comprehensive clusters are usually created following a public initiative. These clusters are dependent on the government. These clusters, of course, focus on medicines, and a lot of international clinics are part of these clusters, and sometimes they make up to 30% of the cluster. So this is a good thing, because it tells us that medicine and medical science is starting to develop globally as a network. The next type of a cluster are more innovative clusters that focus on driving the innovation forward. So these are biomedical and research clusters. They are usually created following a private initiative. The third type of clusters are medical tourism clusters. These clusters provide medical services based on national healthcare achievements or based on certain benefits provided by national healthcare systems. So what are success factors for all of these types of clusters? What is a success factor for large comprehensive medical clusters, such as our cluster? Number 1 is being integrated into the public healthcare system. Number 2, a large number of participants, hundreds of participants, inter-industry cooperation when physicians and medical scientists work hand in hand, let's say, with physicists, and a wide range of medical services. Any medical cluster who has all of these factors will be successful. The second type of cluster, biomedical and R&D cluster, will be successful if it has R&D investment, and it has to focus on developing international scholarly exchange today, biomedical research requires fast exchange of information. And the third type of clusters, international medical tourism. Well, all you need to do to be successful, you need to organize high quality and straightforward medical services for the patients, and some of these clusters need to specialize in providing state-of-the-art medical services and in ensuring good communication between all of the participants and the users. All of the clusters receive public support. It could be co-financing, it could be tax breaks or waiver of custom duties. They can have targeted HR or talent development programs. When I looked at this, I realized that actually our cluster is quite advanced in this regard. And the most important thing, what are the positive effects that we can witness when we start developing biomedical clusters? Well, number one is that clusters can be effective at all levels of healthcare. For instance, very fast implementation from research into care, use of state-of-the-art equipment, growth of R&D investments, and of course the increase in the number of startups. When we talk about medical organizations, they have to utilize technologies, especially if they're working at a regional level, such as our cluster, which is a regional cluster. So once people see that something cutting edge is possible, people will start demanding the same technology from other medical organizations, and that in itself is a growth factor, because these organizations will have to start catering to growing demands. So Moscow International Medical Cluster. What can we do for Moscow? First and foremost, what it is that we want. We want Moscow like it used to be back in the Soviet Union. We want Moscow to be one of the centers of medicine and biomedicine. How can we achieve this objective? We are working with the best international clinics, so with the most renowned professionals in medicine. We are improving our competences, which will improve the position of Moscow as a center for medical tourism. We want to become an international medical education center. For this, we have to attract international experts. We would like the city to have economy which is open to innovations. Everything that comes down to the development in the next decade will come down to the non-material development, to the developments in innovations and knowledge. So we are trying to implement this inter-industry approach. So this in itself will be a model for new economy. I have a bit of a tricky question for you, Mikhail. I used to visit Houston Medical Center, which is probably one of the largest medical cities in the world, employing more than 100,000 medical professionals. So when I talked to the labs, when I visited the clinics, I saw pictures on the wall, statues of some prominent people. So I used to think that those people were famous physicians or medical scientists, but it turned out that all of those people were private individuals who donated the money to the medical center, and the center itself was established following a private initiative. So going back to your project and going back to the experience that you have in research, I wanted to ask you, who is funding your cluster? I understand that this is a public-private partnership. I'm just trying to ask what can we do in the future? What kind of funding schemes we can use? Well, basically, we do not really need to invent anything new. If you look at any other industry, if you look at 2015, 2016, 2017, if you looked at profitability of different industries in the USA, which is the most developed economy in the world, then you will see that all of the industries that are linked to medicine and biomedicine are the most profitable. If you go back to the Russian environment, then we have to say that investment in healthcare and healthcare itself, when it comes to the margin, it's doesn't have the highest margin. Maybe it's number 4 when it comes to margin. But so if you're talking about stability of growth and dynamics of growth, it's probably the leading industry. I believe that is absolutely true. And I believe that private capital wasn't looking too much into healthcare, but the situation is changing right now. We see a lot of financial conglomerates looking into this sector. Well, we've been working with the cluster for 2 years, and 2 years is a very short time, but I have already noted a large increase in interest from private investors, their interest to healthcare and biomedicine. I would like to give the floor to Alexei, and I would like to congratulate him. Today, there was a quote from PricewaterhouseCoopers that Moscow became one of the 5 large metropolises in the world with the best healthcare systems. And I think that that was done largely due to a very well-thought policy that was developed by the healthcare department of the Moscow city government. So if you look at the Russian healthcare system, then I think that the actual healthcare of the Moscow city is a network in itself. We have outpatient clinics, we have large medical centers. So I would like to ask you about possible synergies. What are the advantages when it comes to managing such healthcare networks? What are the advantages for the city, for the payers? And basically, the second question which I have, how can we integrate an international medical cluster into such a well-functioning healthcare network? And what kind of effects we can achieve? I think this is absolutely terrific that we ended up in the top 5. But this is just one of the stages of our development. And I believe that the system of healthcare in Moscow has all of the prerequisites for all of us to achieve a major breakthrough that was announced by the mayor of Moscow, Mr. Sobyanin. You all know that the healthcare of Moscow has changed quite a lot. It became more focused. It became more streamlined. It became more high-tech. So we've streamlined the resources. We applied system-wide or system-based management. We put a patient. We put the patient in the center of the system. So we do hope that we are poised for a major breakthrough. And the Moscow International Medical Cluster will be something that will absolutely contribute to such a breakthrough. This international medical cluster attracts the best international clinics to Moscow. We already have 2 very specific examples. These clinics bring their highest standards, they bring their resources, and they bring their world-level quality.
Talking about the HR resources, apart from even though under the existing requirements, 30% of investment comes to Moscow, and these clinics have to bring their own stuff. However, two-thirds of required stuff needs to be employed in Moscow, and I would believe that would be the best people. available in the market. And this is that synergy that you mentioned, because currently we see that state-owned healthcare system is developing, private medicine is developing, and we know that we have very good doctors who work in both systems or migrate from one to another. So that synergy helps to increase the professional level of those doctors who work in these systems. And instead of the place for these clinics in the entire system of Moscow healthcare is not quite clear. However, any network is built to the demands of consumers, and that's the whole point of it. So Moscow consumers and Russian consumers have right to see that their needs are catered to. And we know that in Moscow, medical business is a big business in Moscow. We have Medicina Ltd, Medsi, Healthy Generation clinics. So we have a number of medical companies, and that synergy effect is well visible there as well. But in any case, in paid medical services account for 4% of the total annual income, and 9% that's the average for the industry. But we do have commercial medicine in Moscow. And now, talking about scientific projects and educational projects, I'd like to say that we will support the cluster development. Let's say Hadassah Clinic appears in the market. It builds its own simulation center, and we have our own simulation center, which we built together with our Israeli colleagues. It's a very good center. We have 250 simulators, which are very close to real-life conditions. But medicine keeps developing, and medical education is becoming better and better. So we hope for the fact that the simulation center, which is currently being built, will be sought after by the professional medical community in Moscow. Science. Large clinics in Moscow, like, for example, Sklifosovsky Medical Center, Botkin Hospital. These medical centers have vast programs of international cooperation, and they display their own achievements, like, for example, robotic surgery master classes, which are carried out by Professor Pushka, robot-assisted surgery operations, which take place in the city hospital number 50. As far as your question is concerned regarding who needs this network and who will consume these services, and whether the networks that we're building are laterally structured or vertically structured, well, I'm saying that these networks are required by the city dwellers. Moscovites are interested in this, and these medical networks create value for our citizens. If a person feels coronary symptoms, then in 5 or 7 minutes he can get an ambulance car, and an ambulance car with a crew that specializes on coronary symptoms and dysfunctions, and he will be placed to the hospital which takes care after the heart diseases. So the network that was built helped reduce the death rate almost 3 times. So the acute myocardic infarction, we reduced the death rate from it more than 3 times. So we also have a network of hospitals. And I'd like to say that if we have well-concentrated resources and we have properly laterally structured network, we will have a high quality of service for our consumers. So we're also building an oncological network and obstetrics network. And to wrap up, I'd like to say that we place a lot of hope into the cluster development. I just mentioned one clinic, but there is my colleague present here with whom we have seen the digital hospital in South Korea, and they start appearing here in Moscow. So we're full of optimism. Thank you so much. I think all Moscovites are waiting for the first clinic to be launched, and I understand it will be launched late in summer. I think Alexei has made a very important point. And he uttered the word which has become a meme, which is called, he said the word digit. So integration of digital networks based on the profile of service, when one patient can get services from a variety of organizations, and these organizations have access to medical history of this patient. That's a very interesting point, and that will be important for every Moscovite. You were right in saying that education is one of the obligations of the medical organizations which are planning to operate on the territory of the cluster, and this is required by the supervisory board. But these clinics will rotate their staff, and just to have an opportunity to work in on the territory of that cluster with the possible perspectives to start working in a medical institution here in Moscow. It will be a good perspective. And I think what we should focus on is the nursing services, and we should focus on elevating the level of nursing services quality. And as a member of the supervisory board, I'm all in favor of this. For the first time in history of the Moscow healthcare system, in June, mayor had a meeting with nurses of Moscow. 400 people participate in this meeting, heads of nursing services, and they have been talking to each other for more than 2 hours, and they've been talking about the future of nurses as a profession in Moscow. So the first step was made, and we need to work on this together with the clinics. So probably we'll have private schools for nurses. So that would depend on the investment, and nurses are trained professionally on a private basis, and people are paying for this. And Mikhail, could you please let Sergei sit on the stage, and I'd like to give the floor to Sergei. Based on my personal experience, 2 years ago, over the course of Vladivostok Economic Forum, I had a meeting with the representatives of South Korean government, and they have a program of getting more Russian patients into South Korean clinics. And this program exists on the national level, and that includes a number of components. So medical institutions have targets in terms of the number of patients. They also have to establish good transportation connections from Moscow to Korea, and they need to have, let's say, foresee some well-forecasted patient traffic. And Bundang is one of the largest South Korea clinics, and it is establishing its presence here in Moscow. Why do you need to have this presence? Good morning, dear colleagues, and that's a very interesting question. And indeed, tourist traffic and patient traffic from CIS countries and from Russia to Korea is growing. However, our presence in Moscow is more related to is not focused on limiting the number of the medical tourists coming to Korea. We are focused on sharing our experience, and we have very long-standing relations with the healthcare department of Moscow. And since 2014, Moscow doctors are coming with professional visits to Korea for the purpose of exchanging experience. So we thought it would be good and reasonable move forward to establish our presence in Moscow. Well, South Korea, 20 years ago, South Korea was nowhere to be seen in the international medical service market. Currently, South Korea has become a very visible player in this market. What has helped you to advance so quickly? Let me briefly tell you about Korean healthcare system and why it happens so that Korea is becoming more and more important player in the international market of medical services. So I'd like to give you an outline of Korean healthcare system. So we have a healthcare Ministry of Healthcare and Social Development, and the target is to become the world leader in the area of healthcare and medical services. So we have to reach out into the international market and become an important player. And we also need to maintain very good position in terms of medical tourism. And as you can see, the number of people coming to get medical service in South Korea is growing. Mainly, this growth is attributed to people coming from CIS countries, from Russia, and from Middle East, like Qatar and Arab Emirates. We also have a sizable patient traffic from China, but for classical surgical operations, we also have people coming to us from Japan and from the United States, because the cost of medical operations in Korea is substantially less than in the US, and the quality is comparable. Ministry of Healthcare implements a number of programs in order to achieve the target that was set. And you can see the key healthcare indicators, like life expectancy, which is 83 years, total medical cost per capita, $2,500, and 7.4%, that's the medical cost in percentage of GDP. And based on that, Bloomberg has rated Korea as the fourth country in the world which has the most efficient healthcare system. Healthcare system prepared by or organized by the Ministry of Healthcare implies easy access to medical services, and we have the three-tier healthcare system like the one you have in Moscow. So tier 1, 2, and 3. So normally, if you need a medical service, you go to a tier 1 medical institution, and you apply there based on your medical insurance. But you, at the same time, you have right to go to the third-tier medical institution, so the one that provides high-tech medical service, but you will have to fully cover the total cost of this service. So you still have this option, or you can apply to the first-tier medical unit first, based on your insurance, and the medical service will be covered by the insurance. Here we have number of doctors, so this is statistical data. 95% of medical services in Korea are rendered by private organizations, like private doctors and private clinics, so which are not affiliated with the state. So it is basically a private business. If you compare it with OECD countries, you will see that the number of doctors and nurses per capita, per patient, is substantially less than in other OECD countries. We have a big number of CT units per patient. Compulsory medical insurance. We started to build it several decades ago. 97% of our population are covered by the medical insurance. But unlike Russia, in Korea, we have one insurance company, which is State Corporation of Medical Insurance. And this insurance company covers from 70 to 80% of costs which occur when a patient needs some medical services, and 20 or 30% have yet to be covered by the patient. If a person has an oncology disease, then the person is put on a, let's say, special list, and that person will cover only 5% of the total medical cost. Estimation of new medical technologies. As you can see, new medical technologies are tested and implemented into practice fairly quickly. So they become practice of the standard healthcare system. I also would like to say a couple of words about the system of medical education. It's very similar to what we have in other countries. 6 years in the university, then 4 years of internship, and then you have to recertify or reconfirm your professional degree, and you have to undergo the recertification process. That is also done through participation in various medical conferences, and based on this, your participation, you get points, and if you have enough points by the time of recertification, you pass it automatically, or you need to get some extra points. So it happens so that medical universities in Korea attract the best students, the best school students, which indicates that elite students go there. Do you charge for the medical education? Yes, the overall cost is up to $10,000 a year. In Korea, unlike in Russia, there are medical universities which teach, let's say, traditional medicine, traditional Korean medicine. Nurses are being trained for 3 or 4 years. A 4-year nursing course is similar to, let's say, higher education, so you get the same status. And Korean healthcare ministry introduced a practice of compulsory medical checks for all people, or for all citizens. So you undergo this check when you're a kid, undergo this check when you're a student, and you undergo 2 checks when you are an adult. This practice helped to increase the number of diseases which are diagnosed at an early stage. So currently, it is very difficult to find an oncology patient in Korea at a very, let's say, late stage.
So if you look at Korea, then you can see that the Korean healthcare system is one of the leading in the world. For instance, 5-year median survival when it comes to treating cancer, for the treatment of strokes, and in other fields as well. So because we have such a well-functioning healthcare system, we managed to achieve the results which brought Korea to one of the top players in the healthcare markets globally. Can I just ask you one question? You know, good healthcare is quite costly, and nobody can deny that. So taking into account the share of costs contributed by the Korean government, you were talking about 70% for outpatient or inpatient treatment. What does it cover? Just the services or medicines as well? No, it covers everything, services and medicines. Well, I'm just trying to understand. I'm genuinely curious. So what percent of its GDP does Korea spend on healthcare? 76%. Okay, so we still have a way to go. There is still room for improvement for us. Okay, thank you very much, Sergei. I would ask the speakers to change again, and I would like to give the floor to Mr. Bindseil. I would like to ask Mr. Bindseil and Mr. Morkus to come forward and take a seat on the panel. So, Mr. Bindseil, Berlin-Brandenburg is currently one of the largest geographical medical clusters. At the same time, we can say that, you know, Germany is different when it comes to different parts of Germany, but we can say that Germany is probably one of the best examples of public-private partnerships in the world. Taking into account, well, probably historical English reasons for that. What do you think contributed to building such successful cooperation models between healthcare operators and the government? How do these cooperation models function right now? Do they have more? How do they manage to attract more private capital, and how do patients benefit from it?
So I think it would be most easy to describe this by the presentation I
Да,
have.
пожалуйста, если можно, презентацию.
While the presentation is coming, a couple of words. Thank you for inviting me for this perfect organization. I have learned that Russia and Moscow not can only organize football World Cups, but also terrific scientific conferences. So thank you very much to the city of Moscow. Actually, first slide, one message for our friends in the United States. The good thing for the people don't start with building up walls. The good starts with tearing down walls. And this was our beginning in 1989. And this should work. And at that time, after the German reunifications, this have been very difficult years. We lost 2/3 of our industry jobs. There was a lot of Zweifel, English word is doubt in the area. What could we do? And the really only thing which was remaining was science. And to build up a health cluster, a life science cluster, the most important thing to learn is really strengthen science, give science the place to work, finance science, first-class science. And then our general idea was very similar to all other places in the world. So take brain, take medicine, and then try to produce money. It was not as easy as this. And we started in the end of the 90s with technologies. And there was a lot of investment necessary. Incubators, infrastructure. You have to pay R&D grants. You have to think of venture capital. You have to think of market access, legal framework, human capital. Most important have been transfer centers and creating networks, which is the topic of our discussion today. In the early years, the city of Berlin and the state of Brandenburg were heavily invested in infrastructure, biotech parks, big biotech parks, to create room for companies. So if they get venture capital, they get capital for intellectual property, for development technology, but not for building room. And so it's important for politicians to create room to create this. In our regions, we started with technology. We started with biotechnology, we started with medicinal technology. And we changed this in 2007 towards a more broader cluster approach. As for example, I had under control some 70, 80 companies working in point-of-care diagnostic instruments. But they are not the physicians that can use all these instruments, and they are not the Krankenkassen insurance companies who is paying all of this. So we needed a more general approach, and I learned here that your approach is more from the back end, from the clinics. Our was in the beginning from the front end, but in health, you have to think the entire value chain. You have really to think from the patient, and this is when we created the cluster, and there's more than just brain and money, it's the people. And in the end of the day, as you mentioned, Minister, must help the people, and the people must need what you have. And then we created a cluster organization. In our case, it was very important. The cluster organization is quite small. It's some 20 people. We are just facilitators. We are just helping the others. You must engage the companies which are existent. So my chairman is from Sanofi pharmaceutical company. So you must bring this full-time employees which have to work for the projects, and you must get the honorary people. And we have more than 150 honorary people from all type of industries, from hospitals, from science, help us. We have some goals which are similar as yours: leading healthcare location, excellent scientific landscape, cooperation, and improving the health of the people. It is important that in those mega clusters, and Moscow is in a position like this, you must have the politics, you have this, you need all parts of the key opinion leaders. This is mainly the capitals that are successful in this area. Right now we are talking about 360,000 people in our clusters, in the health cluster, of a total of 5 million people living there, so it's a high percentage working there. We have right now a position that more than 80% of the venture capital invested in Germany is invested in Berlin. So this, when you are successful, and if you create the right environment, then the private capital comes in. The private capital invests there. However, we are seeing problems for the future that you will face very similar. First is demography. Today, the number of people over 80% in Berlin is 5%. In 30 years, it's more than 15%. This is enormous cost. So there's enormous pressure to improve the healthcare system, not only in the top, but on the broad range. Healthcare, and this is data from IBM, is the most inefficient industry up to now. So everybody is better. Tourism and food and automotive, everything is better than healthcare. So we need digitalization. There will be enormous pressure from the Apples and Googles and Intels, Walmarts in this world. We need to think healthcare very digital. These are the topics we are working right now in our cluster. They will be very similar what we have heard from Mikhail and will be from South Korea. Telemedicine for the rural areas, stratified medicine, so give the patient the medicines, the pharmaceuticals that work, regenerative medicine, digital health wearables, smart living for the elder, big data for drug discovery and development, hospital IT, very important. The incubators are looking a little bit different than 10 years ago. 10 years ago it was just space. Today you must bring together space and knowledge, so a lot of big corporations have their incubators in and around Berlin. I think a very important model for you as well. Not only they have the hospitals here, but also to create the industry, to take use of the knowledge created here. In Russia, we will have a new high-tech institute. We provide data, communication is very important, international networking is very important, and I come to an end. We have to become one of the more important cities in the world, and more information is available on our website. Thank you very much.
Господин Бindseil, то, что вы
Mr. Bindseil, what you're talking about actually resonates with me. This is something that I do every day. Skolkovo provides support to development projects. We are actually developing new technologies and trying to introduce them into the economy. But medicine is very stringently regulated, and I'm sure that you see the same picture in Germany. So we have a lot of new technologies, but these technologies cannot overcome the regulatory barrier, because there are no regulation procedures. For instance, genetics, there was a giant leap forward in genetics. Now physicians are looking at genetic profile. They select personalized medicine, but at the same time, genetic sequencing, gene sequencing equipment is purely scientific. It's not medical. I think only one device had gained medical registration. But if you look at laboratory diagnostics, there are certain procedures which would allow us to provide this service in a lab on a scientific level, and that helps physicians. So how can we do that in a cluster?
Well, especially for us in Berlin, startups and small and medium-sized companies are very important. And those companies have very difficult times because of this regulation. So if you're a big pharmaceutical company, it's quite easy. You can invest a lot of money. I think we must create special areas where we are possible really to try new treatments. This cannot be done by everybody because regulation is important. We would like to have quality and we would like to have safe procedures. But especially in areas, for example, like your Moscow medical clusters also, we must get a chance that we try new things before regulation. And we must be quite safe with the use of big data that things are working. And then we must be faster, and we can be faster and cheaper to get to new treatments and new therapies.
Ну, это такое от нас, людей, которые работают со стартапами.
Well, basically, I think this is our general address to the government, people who work with startups. We have to say that we have to introduce special certification procedures, like clear certification procedures that exist in the United States when a certain lab can gain support, to provide clinical help to a certain patient, and later it can be scaled up by the government. Thank you very much for your input. Well, today we talked about plane loads of medical tourists who are flying to Korea. But here today with us, we have a colleague who is working on the same issue. And he's developing medical tourism, probably not just Russian medical tourism, but your organization is called LeadCare, if I'm correct. So could you please tell us what is it that you do? How do you attract patients to your clinic? And where did you get the idea of medical tourism? Did you have a shortage of patients inside the country? Good day, ladies and gentlemen. Thank you very much for inviting me to participate in this forum. Well, I also support my colleagues. Kudos to you for organizing a brilliant World Cup, and I would like to congratulate you on, getting very far with your national team. I thought we would beat the Croatian team. That's what I hoped for, but the ball is round. It comes and goes. So let's move from football to medicine, but and we have to say that there are players of the Russian national team who were treated in Kaunas, in Lithuania. So we had some Russian footballers who were treating their injuries in Kaunas because we have very advanced sports and rehabilitation medicine. So the reason we decided to look into medical tourism in Lithuania, well, these reasons are probably the same as for any other country. You will not find a single country in Europe that is not offering its medical services to people of different nationalities. That was a trend started by countries with more advanced healthcare, but we also joined this trend about 7 or 8 years back because we have good infrastructure, we have good medical professionals, we have good outfitted hospitals. So why not invite medical tourists to our hospitals so that we can increase our funding and make some money? In Lithuania, medical tourism is mostly focused on private clinics and private rehabilitation and physical therapy centers because public medical centers cater to the local population. So I was asked to talk about our medical cluster, about our success story, and about our journey. Our cluster was founded in 2013. The idea came from the private medical organizations of Lithuania. So we decided to set up a medical tourism cluster. So we jumped right into it in 2013. We started attracting different medical institutions, private clinics, rehabilitation centers, different spas, different hotels, and all of the other centers that were capable of providing these services. Of course, we created the brand. We realized that it is absolutely vital for our marketing. We created a platform. We utilized existing platforms such as social networks. We signed an agreement with our colleagues from Latvia and Estonia, the cooperation agreement. We started visiting all of the largest medical congresses on medical tourism in the world. So this is the first picture of our common booth. We started visiting different countries. We started representing our country and our medical cluster. And of course, we needed to formalize the relationship between our members. So we signed a contract between all of the members of the cluster so that it would facilitate the cooperation. We also submitted an application for EU funding, and we received a European Union grant, a budget of more than 1 million euro. So we started creating the cluster DNA. We started creating the cluster value chain. That's how it used to look. It was an orbital scheme, and now it looks more like a chain. This chain specifies all of the healthcare services and relationship between these services. So this is an infographic that tells about all of our services, providing basic information, organizing all of the logistics, all of the travel, accommodation, meals, and then the medical part, diagnostics, treatments, dentistry, physical therapy, rehabilitation, spa treatments, and then it also incorporates some tourist attractions for the visitors. And at the end of that, we put the person on a bus or on a plane and they leave back to their country. But we remain in touch with our medical tourists to monitor the success of the treatments, and we contact our tourists with special offers for further treatment. So this is our infographic, and it is available online, and it is used by different colleagues from different countries. Let me give you an example how this works when it comes to orthopedics, and orthopedics is one of the most important areas we concentrate on. So if a person comes for a hip replacement, we do the surgery, then we provide a post-operative therapy, whereas in other countries, they just release the surgeon home after the surgery, but we actually do full follow-up, and after the surgery, we send these patients for physical therapy, for rehabilitation, for spa treatments, for recovery and recreation. We provide cultural activities, shopping. And so what we usually say, for the price that you would pay in Germany, so the price of the surgery that you would pay in Germany, you can come to Lithuania, have your surgery, have physical therapy, rehabilitation. You'll have enough money left to do the sightseeing, to spend on shopping, to go to clubbing, and to go back home. Of course, the world is global.
And as we are part of EU, our prices are growing and the gap is closing. We live in a small country, so competition is tough and the salaries are not that high. So we still have some resources to restrict the price growth for these services. So we are visiting all world events on medical tourism, which are set up and organized by the well-known American Association of Medical Tourism. We invited them to our country. We invited cluster experts to come to our country. And there is not a lot of medical clusters across the world. And we were trained by the, let's say, best people out there in the market, trained how to build medical clusters. We visited, we have undergone a number of training courses, and we have contracted the work of cluster promotion to a professional company. So we have commissioned a market survey from them. We have asked them to estimate the internal resources of our companies, and finally we realized that that company is also at a learning curve in their relations with us, because we also were in situations when we had to look for a solution in cooperation with each other, and so that was a good experience for them as well. Also, on a permanent basis, we have different interviews, and here on this slide you can see the financial layout of our cluster. Just to give you an idea how difficult it was to source the funds for financing. So the country is small. Again, competition is tough. Private medical clinics are not a lot around yet, and the state is not supporting us. So we can only fund our operations using our own money or using European grants, which do not come easily. So here is our financial layout. So marketing activities, like the catalog of the cluster, that was quite fairly difficult to build for one reason, because say there is a big number of clinics which are providing the same services. So, but we didn't want to put them all into this mix. We decided to take a different options. We asked these clinics, what are your core services? What is this thing which you are best at? Oh, they all believe that they are good at everything. And that's the answer which we got from them. But we told them, pick 3 items which will represent your medical services. So that was a bit difficult, but however, we implemented this, and in 2014 we got an award for best medical tourism, the best medical tourist product in Europe. And we keep working with a number of countries. I come to Russia fairly frequently with business missions. I come to visit an exhibition. Do you have a lot of medical tourists from Russia? Yeah, the biggest share of those who come to us is coming from Russia. What is the share? I can't tell you, but this is a very sizable segment. Mostly we have people coming from Kaliningrad, then Minsk is the second largest place where patient traffic originates from, to be followed by Moscow and St. Petersburg, and then to be followed by Germany, Sweden, and Norway. Let me ask you a question, because we are quite pressed for time. From the regional perspective, clusters indicate the key or the core service which they provide. For example, Europeans massively travel to Hungary for dental services. so including aesthetic dental services. So what do you focus on? What do you specialize on? Rehabilitation or sports injuries? You're right in saying what you said. In Hungary, you have on one side of the street you have casinos and restaurants, and on the other side you have dental cabinets. In Turkey is the same. Turkey is the same. Turkey is supporting medical tourism and conventional tourism. So they have a very well-built tourist system. So they have all-inclusive schemes for the tourists to travel, and they add a medical bit to it as well. So like sanatoriums. In Lithuania, we also have sanatoriums. This is what we managed to keep from our past. We have further developed the existing system, and our, let's say, unofficial objective is to become a sanatorium for Europe. Lithuania could become a sanatorium for Europe. A number of Russian regions are also aspiring to become, let's say, international hospitals, and some even get support from the state. We closely cooperate with Russian travel operators and travel agencies. A lot of these travel agencies they focus on Lithuania, and they say that Lithuania, in terms of quality, is above everyone else for now. HR, let's say, resources and human resources is a very important matter. How do you resolve this? We have HR resources. And if we look back, in a Lithuanian family, there are two traditional professions, a priest or a minister and a doctor. So it is caring after other people is part of our DNA. So caring about the spirit or caring about the body of. And so this is why we don't have a problem with sourcing good doctors. And if not doctors, then good nurses. So in other words, good staff who can help people in sanatoriums. Dear colleagues, we have to draw to a close. Just one more point, if possible. Something I would like to, let's say, a piece of advice I would like to give to Russia and to Russian medical cluster. You keep talking about technology. Keep talking about investment approaches, digitization. It's great, but don't forget a human being behind all these factors, because a human being is not a robot. So you need to have a human touch when you treat somebody. You need to understand the root cause of a disease. You don't have to treat the symptoms with laser technologies, computer diagnostics, and everything else. You need to understand why the person has developed that disease, that condition. So technology is great, but don't overlook human beings. I feel like going to Lithuania after listening to you. Okay, I would like to thank all our speakers, and I think that we have discussed very interesting things today. We have gone through good examples, and thank you so much. And I wish you each and every success in the very important business of yours, developing medical clusters. Thank you.
На стенде социального развития правительства Москвы представлены ведущие клиники Москвы, где можно поэкскурсировать с помощью очков VR-туры в наши 3 ведущих больницы, стационара.
At the Russian government booth, you can have a video tour around a number of Russian hospitals. So if you are interested in the details of the Moscow healthcare system, please visit the booth of healthcare department.